Namaste. When it comes to children's health, parents and pediatricians mainly focus on the overall well being of our children. This World Kidney Day, our FB Live session as well, will be focusing on children's kidney health. And we're very happy to have with us Dr. Sudha Ekambaram, Senior Consultant Pediatric Nephrology, Apollo Children's Hospital, Shafee Mohammed Road, Chennai, to be discussing kidney health issues and the various conditions relating to kidney health amongst children. Thank you very much for joining us today, Doctor.
Pleasure is mine.
Doctor, we know that the kidney's primary function is to filter out all the waste from the body. What are its other vital functions?
Okay. So kidney is a friend indeed, and as you all know that most of us are aware that kidneys can excrete the waste products, but that's not the only function. I would actually say kidney is equivalent to a mother at home. So a mother is a multitasker at home, and kidneys are again the multitasker organ. So it helps the other organs to function in a coordinated manner, and it also helps in maintaining the hemoglobin, that's the blood levels, and also helps in the bone strength, and it also helps to maintain the fluid and the electrolyte balance, as well as thus helping in maintaining the blood pressure. So these are the other functions of the kidney.
So, coming to the topic of the day today, are children prone to kidney diseases?
Definitely, children are prone to kidney disease, and that's why the speciality. And the kidney disease, what happens in that is they are very rapid and they progress quite quickly. But definitely, certain kidney diseases can be prevented if they are identified at the right time. So it is the prime duty of the pediatric nephrologist to identify the problems as well as to ensure that the progression of the kidney disease is halted. But there are certain diseases that still progress beyond our management. But since majority of it can be prevented, I think we need to identify it at the right time.
So, as parents, doctor, how do we know if our children's kidneys are functioning well or if they are having a problem?
Okay, so we need to be aware of certain symptoms. So if those symptoms are there, then you will have to meet your pediatric nephrologist. So if your child is above the age of 5 and still the child is bedwetting, or if the child is having increased frequency or a reduced frequency of urination, that is less than 3 times or more than 8 times a day during the daytime, then that's another warning sign. Then if the children's they have urinary symptoms like burning sensation while passing urine, or they're having high fever, and with the fever they have urinary symptoms like increased frequency, urgency, or pain while passing urine. That's another problem of kidney disease, and that's one of the most commonest because usually it's the urinary tract infection. Then the other symptoms would be passing blood in urine, or passing stones in urine, or when the child is having a frothy urine, because when there is protein leakage in the urine tends to be more frothy, and when they have swelling over the eyes, that's one of the first signs. You would see that there is swelling over the upper part of the eyes and not the lower part. The lower part is more for the allergic thing, and the upper part of the eyes, if there is a swelling, we are more concerned. So these are the symptoms that you need to look for.
So, what are the kidney diseases, doctor, that affect children? You spoke about these symptoms. So, what are the kidney diseases that affect our children? And is there a specialist that we can go to for this?
Okay, so one of the most commonest condition is the congenital anomalies of the kidney and urinary tract. That is when there is a malformation in the kidney development, and at the time of birth, that even during the pregnancy scans, we'll be able to find out the anomalies. There can be a single kidney, or there can be the position of the kidney maybe at a different place, that's we call it as an ectopic kidney, or there can be a multiple cyst within the kidney, or there can be obstruction in any of the passage from the kidneys to the ureters to the bladder and from the outlet of the bladder. So anywhere there can be an obstruction, or there can be a dilatation because there may be a reversal of the urine from the bladder to the kidney. So this is one of the commonest condition, and associated with it we have the urinary tract infections. So that's also very common. The others being kidney stones, and we have other systemic illness which can be associated with kidney disease, acute renal failure, or we have the chronic renal failure, and as well as the nephrotic syndrome and nephritic syndrome.
So, what are the risk factors, doctor?
So the risk factors would be like in the antenatal ultrasounds itself, if we diagnose there is a kidney anomaly, and if the child is obese, or if it's a preterm premature babies, or if the child has developed any acute kidney failure in the past. And one thing which I would like to highlight at this point is usually one of the commonest conditions that we come across in our day-to-day practice is the kidney malformations, and there will be dilatation in the within the kidney, and that's usually seen in the pregnancy ultrasound. So what generally people think is once the baby is born and if the child is urinating well, then this dilatation will resolve. This is a very common myth among the public because they feel once the baby passes urine, the dilatation is going to come down on its own. No, it's not like that. That we will be able to pick up only with a repeat follow-up ultrasound after the child's birth. So that's something which we really need to give importance when we are following these children. And the other problem is what they think is if the child is urinating well, then there is no kidney problem at all. But that's not the case. There are two kidneys. We have two kidneys. So there is a dilatation or there is a problem or an obstruction in one kidney. The other kidney is always there for us to take care, and this goes very silent. So we need to be very, very careful. So I hope I have conveyed this message very clearly, because this is something which can be definitely prevented from going into a chronic kidney failure.
So, as regards chronic renal failure, how do we, as a parent, as a layman, how do we identify it, doctor?
Okay, so one is there is reduced urine output and there is swelling over the eyes and feet. One is increased urine output, and the child keeps bedwetting even after the age of 5, 7, and that is because the kidneys are not able to concentrate the urine. So we are all aware when there is reduced output, we think it could be because of some kidney problem, but we are not aware that an increased urination, the frequency of urination also could be a kidney problem, because the concentrating ability of the kidney is lost, and that's the reason why there is more urine output, and that is something of concern. Then we need to take care of that. Then second is the growth. The height of the child may not be at par with their peer groups. So that's something which we need to give importance. Then the child may be excessively tired, because I already said the kidneys help to maintain the blood levels of the hemoglobin levels. So when the child becomes anemic, definitely the child becomes very tired. So there is excessive tiredness and the child is not interested in play, and the blood pressure may be high, and so the child may have headaches. So that could be another symptom. And once there is a high the toxic products, they keep accumulating, and that could be a reason for vomiting, nausea and vomiting. So these are some of the commonest signs and symptoms for chronic kidney disease. And the other important thing is the bone malformations. They will have bent bones, so that's also possible. But see, all these are put together, they come into chronic kidney disease. Just because you have one symptom, don't get panicked. You need to approach a pediatric nephrologist. You need to examine, you need to do the blood test and then come to a conclusion. Just because your child is having all these symptoms, don't come to a conclusion that the child is having a chronic kidney disease. That's not what I want to actually convey. But if you have all this, then you need to make sure that you meet your pediatric nephrologist and go ahead with the evaluation.
What are the tests to check a child's kidney health, doctor, today? What are they in specific that we can approach a specialist and ask for?
See, one of the basic tests which you don't even need to go to a specialist, a pediatrician, if you go to a pediatrician and get a blood pressure checked, that's something to tell you that things are fine. That is one of the ways to know that the kidneys are functioning properly. So you can get a blood pressure. It's a non-invasive test. And the other important non-invasive test is a simple urine routine examination. Simple urine routine, it's a window to a lot of diseases. So it gives us an idea, overall idea of most of the kidney related problems, and it is again it's a very simple non-invasive test. So these two tests are something which we can definitely screen for a child. And the other test is we have the blood test where we check the kidney functions, that's the creatinine and the electrolytes, as well as the ultrasound, which tells us if the kidneys are growing normally, whether they are in their position, and whether they are of normal size and shape. So these are the usual tests, though there are a panel of other tests to go, but these are the basic investigations that are there for the kidney functions.
So how is it that a parent can take care of their child's kidney health? What are the tips that we can follow, doctor?
So the tips are very simple, but I think it's very difficult for us to follow at this point of time. So what tips I'm going to give right now, your child may not really enjoy it, because they're all to this modern world and they're all addicted to so many other things. So the most important thing that I would like to tell is, first is the diet. Diet, to ensure that more fruits, vegetables are added in the diet, at least 3 to 4 portions of fruits and vegetables the child needs to consume. And I would say that try giving all this when the child is at home, not when the child is going to school, because it's really difficult for us to see what's happening there. So ensure that they have good amount of fruits, vegetables. The second is ensure they drink water. At least 6 to 8 glasses of water is required. And the other important thing is, like, it's very difficult for us to keep a measure of the glasses of water. So what I would say is, there are 1 liter bottles. So try taking water in the 1 liter bottles, and probably that's a good way of seeing whether your child has taken water adequately. So 4 glasses of water is roughly equivalent to a liter of water. So that's the other thing. And the third thing is, ensure that they don't become obese. One is with the diet and one is with the outdoor activities. Make sure they have a good amount of adequate amount of outdoor activity. At least 5 hours of vigorous activity a week is what I would recommend. Like, put them in some kind of classes. Put them in say a badminton class or a dance class or a swimming class, whichever they really enjoy. It's not necessary that they need to do jogging or walking like what the elders do. This is some activity which they would enjoy. So that's the other way of taking care of their health. And the fourth is, ensure that they are not constipated and they pass stools daily in the morning before going to school, because that is definitely one of the risk factors for a child to develop a urinary tract infection. So make sure that the child passes stool in the morning. And the other common thing that we nowadays see is, the child holds the urine for a very long time. That's not supposed to happen. When they go to school, there may be multiple multiple reasons why they are not going to the toilet, but they have no choice. They have to pass urine at least 3 times in school, and in a total at least 6 times to 7 times in a day they need to urinate. And especially having playing with the mobiles, watching TV, they tend to hold the urine for a long time. So this is something which we need to avoid, and an adequate rest, good sleep is required. Not to see the screen, reduce the screen time. I would say no mobile phone to the children for playing. That's something which needs to be avoided. So an adequate sleep is of at least of 8 hours is definitely required for them. So these are the tips that I would like to give for a healthy kidney.
Doctor, you mentioned about the various foods such as fruits and vegetables that needs to be included in various portions for best kidney health. In the same way, are there foods that needs to be avoided by children?
Yes, I will be the biggest enemy of children because they love junk food. Okay, and that's something which I'm going to say a no to, because that junk foods are having a high salt content. So your the most loved French fries, the burgers, pizzas. So these they really enjoy, but unfortunately these are the food that are having very high salt content. So try avoiding junk food and the aerated drinks. Any kind of aerated drink is not good for your health. So that's something which we need to avoid. Homemade food is the best. And I would say parents also need to learn a little way of creativity in cooking and make your child enjoy the homemade food.
Doctor, speaking about salt intake, should parents or should we reduce generally the salt intake of children, or optimal levels are there that we should prescribe?
Okay, as far as salt is concerned, even if I'm a pediatric nephrologist, I'm not going to say, okay, reduce the content only for your kid. First is us, then it's the kid. So it's a whole family. We can't force in something to the kid without us following that. So, and that's something which we need to follow, and the regular Indian diet is slightly excess in salt than what is actually required. So a practical way of saying how to reduce the salt, as I already said, avoid junk food, because if you go and see the salt content of the junk food, that will be the requirement of the salt that's actually required for the whole day. That is one. Then the other practical way is like some add salt while cooking rice. So try avoiding that. And the other extra salt containing food is the chips and your papads, your pickles, your dry fish. So, and all your labeled packaged food like your sauces and all that. So try. I'm not saying no against everything. That's not possible. But try cutting it and keeping to the minimum. So that would really help.
And understanding the labels behind these processed foods is very important for children as well.
Definitely, they enjoy that. That's why I said I'm the biggest enemy.
So, doctor, are girl children more prone to developing kidney problems, or is it equal in girls and boys?
So as far as chronic kidney is concerned, actually men progress more rapidly than women. But in children, the urinary tract infection, which is one of the most common condition which we come across. So that is more common in girls than boys. Well, if the boys have some congenital kidney malformations, then they are more prone. Otherwise, girls are more prone for urinary tract infections.
Doctor, is it true that regular medication consumption or regular medicine consumption is also known to affect the kidneys? What are the other culprits that can affect the kidney health of a child?
Okay. So the medicines, not all medicines are nephrotoxic, but there are certain, the painkillers especially, they are definitely a big no-no, and we need to avoid self medications. So that's something which is really important, and there are certain IV medications, the intravenous medications, which may not be which may harm the kidney, and I'm sure your pediatricians know about it. And if you all are having any underlying kidney problems, then those are the things that we need to really avoid, and your pediatrician would be a good guide for you all for that. So that as far as medications are concerned, give it to your pediatrician, and I think they will do their best. You don't take it in your hand. As long as we don't do it by ourselves, the risk factor is going to be very less.
So, how do we treat various kidney issues at Apollo Children's Hospital, doctor?
So the commonest is the medical management, where we try to do the supportive treatment, and we try to give the appropriate treatment for the disease. So it depends on what kind of a condition they have, and there are many treatable causes where the urologist is involved, and they really help us to tackle the problem. So that's way of surgically treating it. And if the child has any acute kidney failure or a chronic kidney failure, then if dialysis is required, then we go ahead with dialysis. And there are multiple modes of dialysis, where we do a hemodialysis, or we do a peritoneal dialysis, or a continuous dialysis, we call it. It just runs for 24 hours, 48, 72 hours. That's where we do it for acute kidney failure. And this is in a chronic kidney failure, the dialysis is a bridge. You need to go to the other side of the shore, and that's possible only with a kidney transplant. So these are the various treatment modalities for kidney problems.
Do genetics play a vital role in kidney diseases, doctor? If so, how do we get our child to be safe?
Okay, so genetics is a very upcoming field, and there are many diseases in which genetics is involved, and in certain conditions we have a very definitive genetic diagnosis and answer, and definitely it helps us to identify the condition rightly, as well as at an earlier stage, because sometimes we may not develop all the symptoms, and it's a little confusing. Even a kidney biopsy may not be able to help us with the right answer. So that time genetics really helps us. But we have a long way to move, because there are certain conditions in which the genetics does not give a correct answer to us. But once identified, then it really helps us to put a break in the progression of the disease, and we are able to keep it under control. So that's very helpful. And in the management, I forgot to mention about the kidney biopsy. So that is again another way of finding out what is the problem that's happening within the kidneys for certain conditions, and that also really helps us.
Doctor, children often complain about stomach aches. How do we as parents, differentiate between a normal stomach pain or if it could be something serious?
Okay, so that's a little difficult to identify, because each we have various ways of describing the stomach pain. But for you all to understand, I would say if it is below the belly button, then associated with some kind of urine problems, like increased frequency, or if the child is having pain or burning sensation. So that's where the bladder is, and that could be a kidney problem. And sometimes if the child is having renal stones, then and if the renal stone, they're passing out a renal stone, then they have severe abdominal colic pain, which will be radiating from the back to the front. And very rarely, sometimes the pyelonephritis, we call it, when that is an upper urinary tract infection where the kidneys are completely involved, they might have pain at the back, lower back.
Doctor, we will take some questions from our viewers. I have read that dehydration is one of the essential factors that can affect a kidney health. Summers are already here. Do you have any tips to keep our children hydrated during the rising temperature?
So as I already mentioned, 6 to 8 glasses of water is something which we need to look at, and definitely we can't measure it. So try filling it up in 1 liter can and ensure that the child is drinking water. And if you can, try ensuring that they get good amount of good water even in school, because sometimes 1 liter of water bottle is definitely not enough for them when they go to school, and especially in summers. So either they get a good water in school, or try sending them at least 1.5 to 2 water bottles when they go to school. Water, water, water is what I would say for hydration. And I'm not here to say, okay, drink juice or drink other things. All that is extra. But water is our savior, and that's the best. And that's something which we are getting free of cost. And we need to ensure that we save water also and don't waste it. So it's something very, very essential for maintaining the kidneys as well as our overall health.
Doctor, how often should I get my child's kidney checked from a pediatric nephrologist?
Okay, see, if your child is going to have some underlying problems, some risk factors, as I already told you, if they are premature babies, or if they are having congenital malformations which are diagnosed at the time of pregnancy, or if they're obese, and so, or if there is a family history of renal disease. So these are the various risk factors which we're looking at. So in those children, it would be ideal to get them checked from a pediatric nephrologist immediately after birth, especially if they're having a congenital malformations, or a little later with other problems, maybe after 3 to 6 months. And then you also check them once at the time before they are going to school, and during their adolescence. And that's the way we look at it. But based on the condition of the underlying problems, we need to change the frequency of visit to the pediatric nephrologist. Otherwise, you at least need to get BP, that's your blood pressure, and urine checked at the time of school joining and during adolescence. So that's a way of screening these children, and it will be a good one. We are not going to miss out on certain diseases which are silent.
My child is regularly constipated. How do I improve his stool output?
Okay, so the first and most important thing is diet. Okay, so water and fiber rich diet is what we need to ensure that the child is given. So as I already said, based on your child's age, the amount of water also varies, maybe from 4 to 8 glasses of water, or 10 glasses of water a day, and it also depends on the climate. That's one. And number two is fiber rich food. So you need to ensure that you give adequate amount of fruits and vegetables. And here parents, the common mistake that they make is, when we say fruits, they try to say that the child doesn't take in fruits and they give juice. But the problem of having juice is all the fiber is lost and you're just giving the remaining water. But what I want them to take is fiber, which is actually thrown away in the juice. So I need them to take the fruit as a whole so that they get more fiber. And other fiber rich food would be like your boiled corns, boiled peanuts, your homemade popcorns, and try reducing your biscuits, all the maida or based products like your biscuits, breads, buns, so they may constipate. And the most important thing is early to bed and early to rise, which is not commonly followed by children nowadays. Very, very few of them get up very early in the morning, or they go to bed early. If they don't follow this routine, then when they wake up in the morning, they don't have adequate time to go to school, and that is, they don't have adequate time to dress up and get ready. So it's just half an hour gap most of the children have. Just imagine, what can you do in that half an hour? You can brush your teeth, you can bathe, you can have your breakfast. That's the priority, and some children don't even bathe, I know. So that's something which we need to really give importance, and teach the younger generation how important it is to pass motions in the morning. So early to bed, early to rise. And that's one mantra that you need to follow. And the other simple thing is after brushing your teeth, take some one glass of warm water or warm milk, and then 10-15 minutes do some skippings, do some kind of an activity, jumping, running, skipping, and then automatically your bowels will move and the child will pass stools in the morning.
Thank you very much, Doctor. What would be your message to our viewers this World Kidney Day?
So stay safe, stay healthy, and for that, what we need to advise our children is a healthy diet to keep themselves active and fit. So this, I hope I have conveyed these two lines in my entire talk. Thank you very much.
Thank you very much, Doctor. That was a very interesting session. I hope our viewers have benefited a lot from this. For appointments with Dr. Sudha Ekambaram, Senior Consultant, Pediatric Nephrology, Apollo Children's Hospital, Shafee, Mohammed Road, Chennai, please call 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, Doctor.
Thank you.
Thank you, viewers.